I do not want to hear any more about health system CEOs claiming that they are taking action against gun violence and violence in the healthcare setting, because I call bullshit. I put together a list of just a fraction of some of the recent violent events that have taken place in healthcare settings. These are only like maybe 3 weeks old at the top, and it's not even a complete list, okay? So we've got March 3rd, Richmond University Medical Center in Staten Island. Person pulls out a knife and slashes and injures 6 different hospital workers, including nurses, ER staff, security guards, punches and bites them. They're all gonna be fined. The person was arrested and charged. And it's not just healthcare workers that are at risk. Patients are equally at risk, as evidenced by March 5th, Merit Health, University Mississippi Medical Center, where allegedly a female patient killed a male patient. They were charged with homicide. March 3rd, Roseview Nursing and Rehab Center in Louisiana. Allegedly, a nurse was assaulted by someone, severely injured, but they will recover. That person was arrested and charged with second-degree aggravated battery. Last month, Henry Ford Jackson Hospital in Michigan. Allegedly, a nurse was stabbed in the arm by a patient. That patient was charged with felonious assault. February, Sutter Mills Peninsula Medical Center in California. A homeless person allegedly walked in the hospital, and a hospital employee offered to help him. And so that person allegedly pulled out a knife and stabbed the hospital employee no less than 9 times for offering to help him, because that's what you do. That employee is going to be okay. Last month, Cleveland Clinic main campus. A woman was arrested, charged with assault and aggravated disorderly conduct after allegedly assaulting a MICU nurse and several other staff members, because allegedly, I'm told, they had downtime and they could not access the medical record to call a family member and inform them that a patient had expired. And the family member showed up and was understandably upset, but not so understandably then took it out on the hospital staff and assaulted them, allegedly. Essex Center Nursing and Rehab Center in New York. Allegedly, a nurse was choked with nebulizer tubing, and then when she managed to get away, the patient shoved her into a closet and started pulling her hair out until other employees pulled her off. Should I keep going, or is that enough? Violence is pervasive everywhere in healthcare settings. Hospital system CEOs are not taking it seriously. I'm sorry, hanging a sign up that says we do not tolerate violence here is futile. That's useless. Like, what is that? What is that? You're trying to attempt to make the public have the impression that you care, that you're taking it seriously. You don't, because you're not doing anything about it. If you took it seriously, there would be manned metal detectors at every single entrance, not just the ER. They would be manned 24/7. They would be able to pick up such things as knives, pocket knives, because I'm told a lot of them don't even pick those up. You would have armed security. You would have locked units where appropriate. You would have panic buttons. You would have all manner of things in place. The fact is, you don't want to spend the money on it, not because you can't afford it, but because you do not value healthcare workers' lives.